metric inventory tracking system.
Got it. Okay, thanks very much. And Dr. Eyolfson.
Thank you very much. Thank you all for coming today. A lot of my perspective on this comes from the public safety and particularly medicine. I'm a recovering ER doctor. Did that for almost 20 years. And one of the things that I found in my medical practice, and we studied in our toxicology as well, is the instances of adulterated product. And I would see that. I never saw someone come in just because they had consumed cannabis on its own. It was they had consumed what they thought was cannabis, and it turned out it's something else. Thankfully, although we're worried so much about opioids, there's actually been no, or almost no, recorded opioid contamination or overdose from it. There were other things too, plant alkaloids that could make people so sick they ended up in the intensive care unit, intractable seizures, this sort of thing. And of course, this is a function of an illegal, unregulated market where you don't have the quality control. Has this been tracked? The incidence of emergency room visits, or medical calls due to adulteration of unregulated product, and has this changed since legalization?
So I don't know that I can say it's been tracked to the level that we know whether it's adulterated product or not. We do track emergency department visits as well as hospitalizations very closely. And this goes back to the reported versus occurred incidences commentary at the beginning of the testimony. We have seen an uptick in terms of the number of emergency department visits as well as the hospitalizations. Interestingly, there's been a slight uptick in the 0 to 8-year-old category, which would tell me accidental consumption. But the largest uptick has actually been in the 35-plus category, which tells me that that is more affecting people who are maybe trying it for the first time. We don't have data on it, but there is some level of disagreement as to whether there are more incidences occurring or whether, because it's legalized, the doctors are now more willing to ask the question and the patients are more willing to admit to the fact that marijuana was at play in the situation.
Yes, Mr. Garza, your experience in this?
It's the same experience in Washington State. Early on, we had discussions with the Washington State Poison Center because they were seeing an uptick in calls, and also visits to hospitals with respect to panic attacks and all the things that honestly I wasn't even aware of at the time. But I think that's one of the, I want to throw out another issue, not just the others, but potency and the concerns that that we have, that whether there's an increase in use among adults, what we're seeing is an increase in potency of adults that use, and we're concerned about that. Also, with the lowering of the price, should we be looking at minimum pricing as they do in Scandinavia for alcohol, for example? Because like Colorado, we're seeing the price of cannabis fall to levels we didn't expect.
All right, thank you. Now, here's another question. I don't know if either of you from either Colorado or Washington will be able to answer this. I don't know if there are any states where there is basically a government monopoly on liquor sales. We have this in some provinces. I'm from Manitoba. We have that. They have this. Although this has been relaxed for beer and wine, but certainly for spirits, as opposed to from the 7-Eleven or from a freestanding store. They're all government stores, and Ontario has just announced that they want to make their marketing not in the liquor stores, but through the same body that says the liquor stores. Other provinces will decide whether they want to have this through private storefronts. Do you have, from your experience, any recommendations as to what would work better? First, I'll start with Colorado and then Washington.
I mentioned in my brief, such a model is impossible in the United States today for cannabis, because it's prohibited at the federal level, and you'd be putting these state employees in the position of requiring them to do something that's forbidden by federal law. And when I was on the task force to implement Amendment 64, we had public health officials say, look, with regard to alcohol, we get much better results in terms of public health from government-run distribution than from private distribution. You don't have to worry about targeting and marketing. You don't have to worry about sales to underage people. You can control all of that yourselves. So I think we can't say, it works really well in the United States because we haven't had an opportunity to try it. I hope that at least one province tries it here so that we can see what its effects will be.
Yeah, but you've agreed it's a better public health system, at least with liquor.
I know that public health, we took testimony from public health officials that it was.
Okay,
I can't say that I know that myself.
Okay, sure. Mr. Garza? Oh,
Well, without getting into too much detail, until 2011, we were the monopoly for spirits in Washington State, and Costco, through an initiative, privatized spirit sales. But that was typically the model. The model was less access, no advertising. We had state employees that ran the liquor stores with no incentive, whether they sold 50 bottles that day or 500 bottles, there was no incentive to sell. So that model's been there for 12 other states in the nation here since 1934. We're the first state that was overturned. But there's no doubt that when you have a control model and the government's involved, access is lower, consumption is lower compared to the licensed states. Typically 18 to 20% lower, because you've limited the number of outlets for one. You've limited oftentimes the hours that they can be open. Now, ironically, that was part of the reason that the public said, no, we want to be able to buy spirits just like we buy beer and wine. But to your question, I think there's no question that a control model where the government's involved, whether that's in distribution or retail, has the results that you want, which is minimizing the negative impacts.
thank you.
Okay, Dr. Carey.